Many times in pregnancy, women report swelling, especially around the feet and ankle area. This is commonly due to two reasons. One is that there is increased fluid volume in the body, and two is there is a decreased return from the big veins in the lower half of the body due to the pressure of the pregnant uterus. Commonly, people who report it are we see are IT professionals who may be more sedentary and likely to sit in a position for a longer period of time, and mostly the swelling is around the feet and the ankle area. Sometimes it gets to the point where women feel it fairly uncomfortable to walk as well. So what are some of the things that you can do to reduce this swelling? One is, if you are in a sedentary desk type job, you can always put an inverted dustbin under your feet, or a small stool, and elevate your feet a little bit, and whenever you can do foot circles. You can also move your toes a little bit and kind of keep the venous return from the lower limbs up a little bit by doing those things. You should also be able to stand up and take some walks every half an hour or so. Nobody can deny a pregnant woman a bathroom break. We often kind of joke with the women who take care, come to us for care, that if nothing else, when you take your bathroom break, walk around for an additional 5 minutes, and that seems to improve the situation with the foot swelling, decrease the foot swelling, and also allow for the woman to feel a little bit more comfortable as well. When you go home, in case there has been a particular day when your feet feel much more swollen than normal, you can take a bucket of water and fill it up with nice warm water and put your feet inside them. Again, when you're soaking your foot in the water, you tend to do some more foot circles, some toe movements. Again, that helps as well. And after that, perhaps lie down and elevate your feet. And the key when the swelling is more as compared to usual, the key to reduce the swelling in that situation is not just to elevate your foot with one pillow, but perhaps with 2 or 3 pillows, so that the foot is then almost above the heart level. And whether you're lying on one side or on the other side, it's perfectly okay to do that. You can use say you're lying on your right side, you can elevate your left foot up and allow maybe 10 to 15 minutes for all the fluid to drain from that area, and then repeat on the opposite side. Occasionally, it is even okay to lie on your back with your feet elevated for about 10 to 15 minutes. We don't want you lying on your back for long periods of time, but for a short period of time, that is okay as well, unless you have pregnancy-induced hypertension. But otherwise, it is okay to lie on your back for 10 to 15 minutes. Over and above that, your partner or whoever is with you can offer you a little massage. Again, if you can talk to your care provider, midwives usually will show you, how to do a massage to reduce the swelling. And something that you can do actually is that you can learn that massage, and your husband can, or your partner can help to move the fluid from the foot over through the ankles to the back of the knees, and that helps quite a bit as well. Some of the things that are told to you which are not necessarily correct is reducing salt intake. You should not be reducing salt intake just to reduce the swelling. Actually, adequate amount of salt is important in pregnancy. If you reduce too much salt, your muscle function also suffers as a result of that. So salting to taste is important. Don't add loads of salt to your food, but salting to taste is super important in pregnancy. Drinking adequate water. Again, the body is very smart. If you don't drink enough water, the body kind of says, okay, I'm going in this dehydration state, so let me collect water. Sometimes just increasing the water intake a little bit can also decrease the swelling. Third thing, good protein intake, and we will be talking about this in another video, but basically increasing protein intake is also important, because protein is the basic unit of what forms a cell. And what we see is that when women have reduced protein intake, they tend to have more swelling as well, because the cell walls are not as strong, and it tends to let out some of the fluid, and that gathers in the spaces between the cells, and that seems to increase swelling as well. Also getting a check of whether your hemoglobin level is good. Sometimes we see highly anemic women also have increased swelling. So these are small things that you can do over and above the comfort measures that we have talked about to reduce the swelling. Also, in case you see very high swelling suddenly which comes on very suddenly, which is not only at your foot and ankle but also seems to go into your shin area, or you have excessive swelling of feet, hands and face, you should talk to your care provider. Last but not the least, one of the best things you can do is to take a pregnancy massage. Take it from a qualified provider, and it is one of the best things to improve circulation, feel relaxed and also reduce swelling in pregnancy.